So you're watching the show and you're thinking, I want to talk about my college. I want to talk about my career. Well, I would love to have you. I'm currently looking for speakers to talk about either their HIM program experiences or even about their career. So if you're interested in being on the Health IT playground, please email me at riaready@gmail.com. Once again, the email is riaready@gmail.com. Now, back to the show. Hi, everyone, and welcome to the Health IT Playground. This is a brand spanking new career corner. It's been a while. You guys have been waiting, and finally, I have one for you. And we're going to talk about a career that is very, very popular in the health IT community, but you may still have questions about it. So I have a expert here that is going to talk to us about this career, and maybe, hey, you may leave here wanting to do it yourself. And I'm talking about medical coding, guys. So without further ado, I'm going to go ahead and introduce our interviewee today. Her name is Margarita, and I'm going to go ahead and have her just go ahead and fully introduce herself and just tell us some information about her before we jump into the questions. So floor is yours. Margie. She has, Margaret
Yes.
and Margie, you guys were here, but welcome and thank you for joining me today.
Well, thank you for having me. This is such an honor. Juliette, um you've been my mentor ever since I took your RHIA essential course and everything. And so, it's awesome. But thank you for having me on. And yes, as she said, my name is Margarita Duran-Messinger is my last name. It's pretty long, so we go by Margie. So I've been working as a medical coder now for a little over 8 years. So since 2015, once, ICD-10 came on, it's what I've been doing. I'm an inpatient coder, and I'm in a group where they call it a corporate coder, where just it means all I do is I am able to hop around from hospital to hospital. I'm not tied to any one hospital. So that's, a fancy word for I'm a hospital jumper in that sense, right? So
Yeah.
yeah. But
All
yes,
right.
and that's what I do is inpatient coding.
Okay. Awesome. And just for those that are watching that may not know, what's the difference between inpatient coding and outpatient coding? Just
Outpatient coding is like when you go to the doctor's office, or even sometimes observation or an ER visit, that type of thing. You're not an actual admit to the hospital. And that's what I do is I take the stays where you're in the hospital itself.
Gotcha. Okay. Well, without further ado, my first question is always, how did you learn about health IT?
Well, that is a story in itself. This lady whom I adore so much, and we were living in Colorado at the time, she was an outpatient manager at her hospital. And so she's the one that would tell me bits and pieces of, hey, this is what I do. I think you would like this. You like to read. So why don't you take, classes for this? And I had a son at that time. And that's what's great about this program is you can go to school while you've got your regular life going. And you can do this while regular life is happening. So she's the one that taught me what you can do and what it's all about. It's all about capturing that patient's time that they spend either, well, in her case it would be the OR in observation, or I'm sorry, not the OR, the ER in observation. Or she said that there were other coders that would take care of when they were admitted. So they would have like two records, right? One for the outpatient and one for the inpatient, since both do work at the hospital facilities. And
Okay.
so I took her up on it and I went to school, and I ended up going to a community college, and it's online, which I love because I didn't have to find babysitters or anything like that. I would just take the classes whenever I had time, which was a wonderful thing for, being a first time mom, because I had to figure out, how am I going to do this? And so, sometimes 2, 3 o'clock in the morning, I was doing my classes, turning in things, whenever you can. I had a 9-month old at that point. So I was like, I got to do something, even though I'm, married and all, but still, what happens if something happens to him? I needed to have that security for myself. And that's when I went to, I got my associates at the San Juan College online program, and that's in Farmington, New Mexico. That was one of the cheapest ones, and that's why I did it, was because, we all have to mind our money. So that's what I did. And I graduated in 2014, and that was it from the HIT program from
And
there.
and what kind of classes did you take in the program? Obviously, like you learned how to code, but
Yes.
like what are the main topics that were a part of the program?
Well, because when you're going to classes for the HIT, which is Health Information Technology, they're also gearing you in case you get into management. So we had, how to communicate with people. We had obviously medical terminology, anatomy and physiology, um, just things like that. And then, of course, then we gathered into how can you manage people,
Mm.
because once coming out of the HIT program, you qualify to sit for the RHIT, which is Registered Health Information Technician. And once you go on and get a bachelor's, as I did from Stevens College, right in the middle of the pandemic in 2020, the worst year for anybody, I finished in December. And so that is just more of a management pattern, right? So the RHIA is for the career progression to go into management.
Got you. Got you.
Right.
Okay. So my question now to you is, what does your day-to-day look like? You've now finished this associate's degree. You now are able to, be a medical coder. What
Mhm.
does your day look like?
Okay. Well, there's a list. Either two things can happen. You either go and you pick from a list the patient charts that are ready that are discharged, because we don't do anything while they're in house. We do everything when they're discharged. So either you're assigned or it's a list. In my case now, it's a list. So what I do is I go and I pick the higher dollars first, because you want that big money to be out of there fast, right?
Yes.
Because there could be something that you need to ask the physician for, and there's going to be a little bit of time, but we're all on a time schedule, because if you don't get those billed timely, then you will not get the full amount of money back for the services that were provided. Not to get the most money, because that's really not the issue. The issue is just getting the correct amount provided for those services that were provided for them. So what I do is I open up a chart. And then I start reading from the ER visit all the way to the discharge. That we go from one day to the next, right?
Yeah.
And all I do is I start abstracting. Okay, well, they have heart problems. Um, they've had a stroke in their past. Anything that would make it a little bit more expensive, or like say they have some kind of handicap or something that is going to require more focused attention. That's what you pick up, right?
Yeah.
And anything that's going on at that time, because there could be multiple issues, or there could be something very simple, like say the birth of a baby. Well, we're here because we're going to have this birth, right?
Mhm.
Compared to, say, it's the end of life care or whatever, that type of thing. So you just pick up what's relevant to that episode when they're here. You don't want to pick up everything, especially things that have already been, as what they called, resolved. Like say they had something happen, but we had a surgery and it took care of that. So you wouldn't pick that up.
Okay.
So just relevant things for there at that time. And you just go through the chart, read everything, pick out what's necessary
Mhm.
through the encoder, and then just keep it moving. Just finish that out and keep it going. And then you keep going on and on and on, until your day is done.
Okay, so it sounds like it's a lot of repetitious work. You open a chart, you're
Yes.
analyzing, you pick your
Mhm.
codes, next chart, and you're just doing that all day long.
Right. And you would think that that would be boring, but it's not, because every chart's a different story. And a coder tells the story of the patient while they're there in house. And you want to tell the most complete story that you can, so that you get paid accordingly. It's not, what I like about it is that sometimes you get very challenging charts, because we're trying to figure out, as they say, what got them off their couch and into our facility.
Mm,
The main reason that they're there. There could be a whole lot of little things, right? But as the guidelines say, um, after study, what was it after they did all of these procedures and tests and things like that? What was it that brought them in?
got
So
you.
it's kind of like a little mystery,
Yes, it's
you know? Yeah,
it's
it's very interesting.
it sounds like you have to, it sounds like you're reading novels,
Yes,
and like
exactly.
the medical charts are novels, and you're just reading it and trying to retell the story and make the best movie possible with every
Exactly.
single chart.
Yes.
Okay.
Hmm.
Okay, I never thought about that way. What about, because you did mention doctors, so how do you interact with other members of the hospital or clinic or wherever you are? How important is communication when it comes
Very
to
much
the job?
so. Very much so. You can't lash out at people, right?
Mhm.
Because it's not professional. And that's another thing that they teach you in school, is the communication, how to keep it professional, how to ask things. Because sometimes I need to go to a surgeon and say, okay, this isn't clear in your operative report. So I'll give the example of a fusion, because I had this happen. And the fusion, he didn't mention what he was using inside the actual disk space, right?
Okay.
So I had to send this out and say, okay, this is what you've said so far. This is what I'm seeing on an implant record. Is, could you please tell me, what did you use here? Because if I see it, that he has it on an implant record saying that he used it, but he doesn't say he used it, how do I know he used it? Because I'm coding off of what he says goes on there, right?
Yeah.
So once he confirms that, yes, I did use this, then I can pick it up. Because we as coders cannot assume anything. We go by and code on what is written there. So the documentation is what we are going off of. There's no assumptions at all.
Okay. Okay. That is hard, because that would be hard for me to do. I'm thinking about myself, because I'll be like, he meant this, but
Right.
you cannot do that
Oh
at all.
no. And
Okay.
the auditors will get you on that, because it's happened to me. But once and done, I learned, right? And it's you just can't take anything. Oh, he might have thought about this? Or now it's gotta be right there, black and white. Of course, there's exceptions to, like, say, you have hypertension and you have a CHF, right? The congestive heart failure. Those two, because of the guidelines, and that's another thing, is the guidelines we have to learn very well. And there's coding clinics to help us out as well. So there's certain things that you can automatically assume that go together, but that comes with experience and with learning that the guideline says I can do this, then you can pick it up, no problem. But certain other things, like I gave that mention of the implant things that he used, the graft, whatever, that type of thing, there's no, you just can't until they tell you, because there's so many different things that they can use. And we also interact with nurses,
Mhm.
which are usually what they call CDI, which is the Clinical Documentation Improvement Team. And we deal with um, quality issues as well, because sometimes we'll have events that shouldn't happen, but do happen. And we pick it up and say, okay, look, this could be a problem. Say it's an ulcer, a pressure ulcer on their buttock that wasn't there when they came in. So
Oh,
that automatically is noted as a hack, right? A hospital acquired condition, and it goes to review. And so we try to figure out, well, was the beginning there or not? So I have to communicate to these teams saying, look, I saw it on such and such a date, but the patient was in house, say 5 days. So where do we, how do we handle this? And so there's a lot of interaction between teams. It's not just me looking at papers or, now the EMRs and just reading off of that, because I get a lot of emails sometimes with, a director of this or the hospital director asking me, how's this going? How's that going? Can you get this chart out? And if I'm waiting on something, I need to tell them, no, I can't. And here's why. And you can't take anything really personally. We got to be ducks where things roll off our back,
yeah.
because, sometimes people will start pressuring you to, hey, get this out. But if you can't, you can't, because you need to have full documentation, not just for my benefit, but for the benefit of the patient. And that's how we serve the patient the best, is by telling the most complete story that we can for them on their behalf.
Okay, so you did mention about guidelines, and I've had some time to look through code books and all that stuff.
Mhm.
So how much time do you think it would take someone after doing a associate program in coding? How long will it take them to really be classified as a good coder? And just in your opinion.
I think it's a continuous process, simply because it's always changing. Um, every October the 1st is when the new code set comes in. So it's a continuous change, right? They're always adding, subtracting, so you're always learning. But now after COVID, what was interesting about COVID is COVID changed a lot of things for us. Now we have two yearly updates, April 1st, October 1st. So I'm always having to read the guidelines. I am no expert. And I always have a copy. They're free. You can get them on CMF, and just Google them, whatever year. This year, of course, it's the 2023 version, and just keep reading it. There's never, it's always changing. So it's never boring, and you just got to keep reading them up to date. And a lot of people at first, when I just came out of school, I said, how in the world am I going to learn this? Well, you can't learn everything at one time. So you learn pieces. Okay, I got this down, right? Or you'll think, oh, there was a coding clinic about this. So even if you don't know the exact answer, you can always go back to your references and pick it up from there. So as long as you remember, hey, there was a coding clinic on that, you can search it up and look for it. It's research. it's a lot of, okay, I think I can do this, or, you know, calling up your other coder buddy. I'm on the phone all the time. Even though I work from home, I have a lot of coder people that I communicate with. Either they're calling me for help or I'm calling them for help and saying, look, am I crazy here? Is my train of thought going the right way? Because if it's not, hey, I'm human, right? And
Yeah.
so we all learn and we communicate um back and forth. So even though I work from home, I have a lot of communication with people every day, be it chat IMs like on Teams,
Yes.
or emails, or on the phone. So it's not lonely so much, and it's not boring.
Okay.
At least I
Okay.
don't think it is.
Yeah, I mean, everyone has their own thing, right? So I don't think it's a boring job. We definitely need it. But in your opinion, what type of person, because you've been kind of outlining the perfect person, they have to be able to have things roll off their back. They have to be very inquisitive. They have to be able to do a repetitious job. There's some traits there, right? You have to be a lifelong learner. What are some other traits that if someone here is watching and they're like, am I a good fit? Like, what kind of person should I be? How would you, like, what else would you say the person should have as a person, their personal traits to succeed in medical coding?
Well, I think you need to like to read, obviously, because that's what we do all day long. And research, it's not as hard as people can make it out to be, but you got to learn when to stop going down the rabbit hole, right? You
Yeah.
just can't get in there and just continue and continue and continue. You've got to find, okay, quick solution, somebody who's a fast thinker, um or even if you're not that fast of a thinker, but you can put things together and say, wait a minute, I saw this somewhere and he said this elsewhere, right? So you're kind of, like you said, inquisitive, and somebody who can put things together. So um as in bad mood, good mood, I don't think it matters. Honestly, because I've met both. I've met people who are easy to work with, some that are not. And you just got to be adaptable, because sometimes you're going to come up with somebody who doesn't want to be wrong. And in this area, it's follow the guideline. The guideline is what's going to save my tush all the time, right?
Yeah.
Because if I can throw out a guideline or a coding clinic and say, look, this is what the rules say, how can you fight against the rules?
Mm. So you have to know the guidelines strong enough to defend it in case there's a
Yes,
provider or nurse or anyone that is questioning your recommendation.
yes, exactly. And the best way to do that is I download it on my computer. And when I need to find something, I click that Control F and I type, right? Like today, I was asked for postpartum, how long is that? Well, I never code anything having to do with moms and babies. I just don't, because that's not what happens in the hospital where I mainly work. But I did the guideline thing, and Control F, typed in postpartum, and I found out it's 6 weeks. And so I let them know, okay, look, it's 6 weeks, and thanks for teaching me something, because I didn't know. So now you do, right? And
Right.
it's easy like that, by doing searches and just sharpening your skills all the time and not being afraid, because I see some coders that are afraid of, say, cardiac, right?
Mhm.
But how do you get over that fear if you don't take one on? I was afraid of fusions forever. Finally, I came here and I said, okay, it's time. right? So maybe about 5 years after when I first started.
Mhm.
So it's been 3 years that I said, okay, it's time to slay this monster. And I went after it. And so, you just learn the jargon that they use because doctors get very settled in how they speak in their op notes, and they'll tell you certain things. Okay, I was here, I was there. And once you learn the anatomy and their verbiage, it's fine, because then you learn, okay, he's talking about this certain part. So
Mhm.
now you know where your anatomy is, and that's where the anatomy comes in. And thank God for Google, because you can search up anything. Like, say you have to find a certain joint. Well, look it up, go to the images, and boom, it's there. That's what we do all day.
Mhm.
That's part of the research. When I was saying about research, it's not all just book and guidelines. A lot of it is going onto Google and finding where is this located.
Perfect. And that's a great caveat to my next question because, as you know, AI is the buzzword right now, and there are
Yes,
products out here where they are actually replacing coders, right? And not replacing, to get rid of them, but replacing
yes,
to help with productivity, right? So,
yes.
what are your views on the use of artificial intelligence to assist in healthcare for coding? Are you for it? Are you against it? What are your views?
I have worked with AI. It's called CAC, the computer aided coding, right? We all call it CAC.
Yes.
Well, they said back in 2015, you guys are going in the wrong profession. Well, guess what? Machines aren't always right. You have to have a coder go behind it to verify that the machine language is correct. Most of the time, it's not. So it picks up little things. What my experience with it has been that it picks up the wrong things a lot of the times. But if I don't correct it, it doesn't pick up the correct things the next time. So what you have to do is actually click on the code, like right click or whatever, and tell it, no, it's not this. This is the code, and correct it. So the next time it can learn. I think it is a good tool. It's not always right. And you have to have the expert behind it. It can help you locate things, but it's not always right. So they've been saying for the longest time that it was going to take over our job, but it hasn't. In the 8 years I've been doing this, they want more coders than anything. That's even working with the AI. So yeah, I think it's a good tool, but like I said, it's not always right.
Okay, so you feel that there's still job security
Oh
even
yeah.
with, yeah, I'm just trying to, because I know that there are
Yes.
people that are thinking, oh my God, I want to do this,
Yes.
but AI is coming in. Like, should I do it? So you're saying yes. If you still are
Yes, do
thinking
it.
about it, do it.
Yes, definitely.
Okay.
Because, I had that fear too. Oh my gosh, why am I going to learn this if the machine is going to take over, right? But you got to fix the machine because the machine can't fix itself.
Mm,
Does that make sense?
yes. Yes.
Yeah.
Yeah.
So no, I'm not scared.
Like, I'm not
Bring it
scared.
on, that's fine.
Come on, AI. Come on, machine learning.
Exactly. Come on, because I can fix you.
Margie. Let's,
Right?
yeah. Let's,
It's
let's,
just like Dragon. You know how Dragon is, Juliette.
yes, yes.
It gets things wrong all the time. And I'm in
Yes.
stitches laughing because it's saying it's one way or another. And I have to sound out things going, oh my gosh, Dragon, where did you get this from? You know?
Well,
It's strange, but I guess because the pronunciation from one person to the other, it doesn't know. It'll throw cupcake in the middle of something, and I'm going, a cupcake in the middle of a surgery, really? And I have no idea what it means.
I understand.
Yeah, it's strange.
No, it's true. I have
It
definitely
happens.
seen it. I've definitely seen providers use Dragon, and it did not do what they wanted it to do. So it really just has to
Exactly.
adjust to the person. You're definitely right about that.
Yeah.
Let's talk about just the job market, right? Me personally, whenever I get on LinkedIn, there's someone looking for a medical coder, looking for a
Hmm.
medical coder. The jobs seem to be everywhere, right? But for some
Yes.
reason, people are still struggling to find jobs in medical coding. Why do you think that is?
I think what happens is, like when I first came on, I was lucky enough to get on with a company that gave me a chance. A lot of the times you just have to get in where you can get in, whether it be like, it's not necessarily, maybe not be coding, but it could be something like filing, ROI, stuff like that. Just wherever you can get in. That was going to be my plan. If I didn't get in with coding, I was going to go in and do whatever it was in the HIM department that I could. And then, of course, you show them that you're interested in this, and you just move up from there. Or you can luck out the way I did, because I seriously did. And we were picked up with a company who wanted to grow their own coders. A lot of the times I've seen entry level positions where they're willing to give people a chance. The thing is trying to find them in the search engines. So I was always entering entry position, right? Or entry level, beginning level, something like that. But I think the entry position is the one that works the best. And they're out there. And especially if you get your coding credential, whether, you could start out with the RHIT. Once you've got the CCS, that's kind of the golden ticket. The CCS being the certified coding specialist. You can go outpatient, inpatient, both. However, it doesn't matter. That one there is the one that I always tell people when they ask me if I was going to be doing something after the RHIT from the community college.
Yeah.
What do I do? I tell them always the CCS.
And how hard is, because I know that exam is hard because I see everyone talking and posting about it.
Yes.
Um, how long did you study to take that exam? And for those that are watching that may be studying for that right now, what
Mhm.
tips would you give them as they're preparing?
Okay. First thing is do the prep from AHIMA, because since they're the ones that give out that certification,
Mhm.
that helped me immensely. 3 months and I was done. They give you 3 months from the time that you purchase it to end your study. And that's what I did, is I did the 3 months. And after that, it was invaluable to know, because they give you tips that were on the test, right? So they'll say, well, this is how you're supposed to code a sepsis. That was on the test. Sepsis is always on the test because it's very particular.
Mhm.
So that's the first thing I say is, yeah, it's going to cost you a little bit of money, but you're going to make it back. And it helps you um, because they're the ones that put out the test, right?
Yep.
And get their entire package, the online courses and the book material, and just keep going over and over and over on it, because this you're able to take your books in. One of the things that I would take in is the medical dictionary.
Yeah.
Not very many people know you can take that in, but you can. Your medical dictionary, because they throw out these words that, oh my goodness, what does this mean? And when you see it, it's like, oh, okay, I get it. That's it. that your CPT books know how to read your books, and know how to find from the tabular, how to find the code from the beginning to the end, from the index and then go to the tabular and then go on the specifics and know how to find that. I think that's the easiest way to do that.
Okay. Well,
And
guys,
write in the books. That's what I did. I had
in
a
the book.
lot of written stuff on there, right? Yeah.
Mhm. Okay, so write in the books. Take a medical. I've never heard anyone say that before, but the medical dictionary, you can take it in. I didn't know
Yep.
that either. So
Most
that's
people
good to know.
don't,
Yeah. Well, you guys heard
unless they've
from
changed
awesome.
it.
Yeah,
But
check.
yeah, I
But
took mine in.
okay. Okay. Now, for those that are still on the fence, still thinking about it,
Mm-hmm.
what advice would you have for someone if they're considering it, but they're not really sure? What
Okay.
advice would you give them to kind of learn if this is really for them or not?
If once you do the RHIT program from the community college, right? They're going to make you go and shadow. And I would ask, I was very lucky, even though at the time I was like, really? I don't have to do more than say a week, right? They wanted me to do 2 weeks, and I was like, oh my goodness, all right. But I think that was the best because they showed me from the moment that they get the medical records from the ER, they scan, they index, they put it in here ready for the coders when they come in, right?
Yeah.
And then they showed me the entire revenue cycle,
Oh,
all the way to boxing them, scanning them again, right? Boxing them and sending them off for storage. So I got to see from the beginning to the end. And I think even if they just make you do the 1 week, if you ask, can you please show me the entire revenue cycle? I think that's the best because then you get to see where you want to be,
mm,
where it is, because you can start off with scanning and all of that, right?
yeah.
And then you can start out like I said, sometimes they have the filing, sometimes they don't, or they're trying to find lost records or whatever, that type of thing. But you get to see every little bit of it. And you, okay, well, maybe I fit in here. Maybe I fit in there. That type of thing. Another thing that I liked about this career field is you're not stuck. Because once you get in and you get your RHIT, RHIA, whichever one, even if you get your CCS, you can move around. Say, oh, I'm tired of coding, right? I'm done. I can go into revenue cycle and say be a supervisor and start taking over the operation part versus the coding part. It's very open. You can do informatics, you can go into data analysis, different things like that, or you can do CDI even if you want for the clinical documentation improvement, right? It's very diverse. You can branch out so you're not stuck. Like say, if like my husband, he's a teacher, right? He can only teach one thing unless he goes and gets another education to teach something else. It's kind of the same because you can say, okay, well, I want to learn about privacy and security.
Mhm.
You can go and do that as well. It's very open. And once you got your feet in, you kind of can go anywhere you want. Another thing is, I've always worked from home. So that's another perk is working from home. So
Yeah.
I don't have more than a 10-second commute, you know? I don't have the wear and tear on my car. Who cares what I wear? you know? Stuff like that. I mean, it's simple. You can, once you close your door, then it's work time, right? That's the one thing I would say would people kind of ask me, How can you do it? How can you work from home? Well, when I close my door, it's work. It's not home anymore. You got to have that discipline to do your 8 hours because, oh, I got to go put the wash in the washer or I got to go clean it. No, you can't do that unless you're on your lunch, right?
Mm-hmm.
And then, okay, that's on your time. But I think that's the question I've been asked the most is how do you do it? Well, you got to discipline yourself. That's I think the only negative, if there is a negative, which I don't think it is, because once you close that door, that's it. You're at work. But everything else, staying home, it's a huge blessing. Um, Name your price, kind of what it is right now with coding. Because if I want to go, I can tell them now I won't take that job unless it pays me $40 an hour or more
Right.
because of the background that you have, right? Depending on where you start. I'm over the $40 an hour. I don't mind making less because I don't want to do trauma ones at this point.
Mm-hmm.
I've been there, done that. I worked at Baylor. I did what was a University Hospital in Newark, in New Jersey, all from here, from my home.
Right.
You get to work at these prestigious places, and if you want to value yourself top dollar, but you're going to work for that, right?
Yeah.
It's a wonderful shovel because you can decide, well, you know what? I think I want to take it easy now and I won't get those hard jobs. But you can. That's the beauty of it is you can dig out of a hole, as I say, with the big shovel that we have because we make our own value, I guess is what you can say. You don't have to take a low paying job unless you want to.
Right. Right.
Yeah.
Now, my question is, after hearing you say all of that, for yourself, where do you see yourself professionally in 10 years? Right now, you are a corporate inpatient coder. In 10 years, where do you see yourself?
In 10 years, I would see, I have a 10-year plan with my husband and we're kind of working on it. So
Gotcha.
I would like to be able to go part time or not work, depending on what I want to do, right? Depending on how hard I work right now, either I pay everything off and be able to sustain myself in these 10 years by working part time, right?
Yes.
I honestly, right now, that's kind of the goal to be able to do that. Doesn't mean I'm going to, but put myself in a position where if I don't want to work, I don't have to.
Nice.
See?
Yes.
Yeah. That's what first goal we met already is we paid off our house. Thank God for that.
Amen.
So the next thing is I'm paying everything off. So, come Christmas, I might pick up OT, maybe another PRN or part-time job, depending. And there's short-term contracts there. You don't always have to work full time for somebody. You can do a short-term thing contract-wise, even though you're full-time with somebody else. As long as you don't have you can't have another job, a non-compete or something like that, right?
Okay.
There's always availability. Like, well, I'll give you an example. During the time when COVID happened,
Okay.
a lot of people lost their jobs, the
Yes.
coders included. But where I was at, we had so much work, we didn't know what to do. They offered us unlimited overtime.
Oh,
What other industry gave that to people? The world was shut down. I was so tired of working all the hours. That's how we paid off our house is, just working and working and working because as people were coming in, yeah, the doctors and the nurses, they did their part, but we do our part to get everybody paid because I don't know if people don't realize this, but it comes through our hands first, and then everybody from the top down get paid on our work.
That's true. Very true.
So, we get treated like little peons, whatever, sometimes, but honestly, we're the ones bringing in the money.
That's correct. Okay. Well, I know that this is a very vital profession. And
Yes.
one thing, people often get confused. People say, I'm a medical biller, and they say, no, well, I'm a medical coder. For those that are watching, what is the difference between a medical biller and a medical coder? I just wanted to clarify that with you.
Okay, the best way I think is, because a lot of people do tell me that about the billing. Oh, you're a biller. And I'm like, no, I honestly don't know much what they do other than, they'll post amounts and things like that, right? My end is I put all the codes on and then I send it to them in the business office where the billers work, and they send it off, I guess as a package or something to get paid, right?
Yes.
So what I do is, like I said, we tell the story, we put all the diagnosis into letters and numbers using the encoders, right?
Mm-hmm.
And then we say, okay, it's ready to go. We're trying to do what's called a clean bill, which there's no questions, so that it gets the stamp of approval, it gets paid fast.
Yes.
So we try to clear up everything, tell the correct story, and then we send it off to the billers, and they do their magic and they get it sent off. So I honestly, as for billing, I knew in the outpatient that they post payments and things like that.
Gotcha. Okay.
Sorry, I don't know much about what they do.
You're fine. Just because I know that like that's a common
Yes,
question. Like, what's
it is. What's the difference?
Yes. So there is a difference. Just wanted
Yes,
to
there
clarify
is.
that. A big difference. Awesome.
Mm.
So before we end and close this has been a great conversation. Is there, or rather, if anyone has any questions or wants to reach out to you, what's the best way to reach Margie?
LinkedIn. I have my LinkedIn account. They can send me, what are they? The connection requests or the PMs, whatever. It's under Margarita, and then Duran, it's Duran, and then hyphen Messenger, Messinger.
Yes. And I
That's
will
the best
also
way.
put it in the description for those as well. So no worries.
Okay.
Yes.
Thank you.
I will put it for you guys as well. But yes, LinkedIn, if you have any other questions for her about medical coding, is there anything that you wanted to talk about that we didn't talk about that you think, you want them to hear?
If you're on the fence, talk to other coders and all, and see what they like. Like I said, you can make your own value on there, and it's a really good industry, especially if you want to work at home, because it gives you the blessing of being able to raise a family at the same time. And um it's really awesome to be able to close the door and you're out of the office. There's no commute time, none. It's awesome. You get to communicate with people even though you're working from home, but you still have the interaction with people. So a lot of people I know are turned off about, well, I'm not going to be in an office. And, there are people that want to be people, right? Be having those interactions. What you do, you can call people, you can DM, whatever, that type of thing. And there's help out there. I absolutely love this because once you're in, and like I said, I would take any job to be able to get in there and then start, okay, well, I'm interested in this, I'm interested in that, and this is what I've done. And, it might come down to even, hey, can I try to do that? What do you think about this? Have conversations with people, see where you think you would fit in the best. But I think that's it. It's a really good industry. AI can come in and try to do what it wants to do, and yeah, we're using it, but we work with it.
Yes.
I don't think it'll take over.
No. Yeah. I
Yeah.
agree. We still need coders. We will always need medical coders. Just
Yes.
technology is there to just support the coder and
Right.
help you guys do other things, because there's other
Mhm.
things going on aside from just looking at charts that you guys have to deal
Exactly.
with.
Yeah.
Right, perfect. Well, that was a perfect ending to that. If you are thinking about coding or you're on the fence, hopefully she has answered questions that you've been thinking about. And if not, once again, you can definitely reach out to her on LinkedIn, or just put it in the, in the comment section. We'll send it off to her. But thank you so much, Margie, for your time. She's amazing, duh. But thank you for your time.
Thank you.
And I will see you guys on the next Career Corner soon. Thank you. Bye, everyone.
Bye. Thank you, Juliette.
Bye.